Do you have allergies or hay fever? The weather's getting warmer, the smell of the grass, the cherry blossom, and all of these beautiful flowers can be very irritating for people with allergies. Your throat is tickling, your nose is stuffy, your eyes are red, swollen, and above all, they are so itchy, like you just want to take out your eyeballs and scratch them. On top of that, you may have watery eyes or even sticky discharges coming out. Your eyes may feel gritty, like there's a hair stuck there. This red, swollen, and itchy eye is called allergic conjunctivitis. It can be seasonal, and you could be allergic to things like grass and pollen. Your symptoms may only come in the spring and summer months. Eye allergies can also be perennial. You might be allergic to things like animal dander or dust, and your symptoms may be year-round. I'm Dr. Sunny, an optometrist. In this video, I want to give you evidence-based tips on what you can do every day to relieve your eye allergy symptoms, what medicated eye drops are good to use, and what you should not do. The first thing you can do is to reduce the amount of allergens you are exposed to. You can do this by adding an air purifier in your home. Wash your face when you come in from outside. Wash your clothes more often and use artificial tears. Artificial tears can wash away undilute allergens in your eyes. Artificial tears can also form a temporary barrier that prevents the allergen to come in direct contact with your ocular surface. Brands such as Sustain, Refresh, or Blink are all reliable. I do recommend using preservative-free artificial tears. You can find them in these individual vials or these specially designed bottles. You can consider using them 4 to 6 times a day or more. Very important here, by using artificial tears, I do not mean Visine. I will go over Visine later. The second thing you can do is cold compress. You can do this by using a cold towel or get an eye mask from your optometrist's office. The cold temperature will constrict the blood vessels and slow down the inflammation, so your eyes will look less red and less swollen. Depending on how much allergens are in the air, you can also consider avoid going outside if you can. There are websites and apps that track the air quality and even comment allergens like pollens and mold concentration in the air. I will put the links in the description. If you have to be outside all day, wearing a pair of close-fit wraparound sunglasses can also be a helpful barrier. If you use bi-weekly or monthly contact lens, ask your optometrist to prescribe you a daily contact lens so you can use it during the few symptomatic months. Allergens can stick to the lens surface, so using the same lens repeatedly can increase your exposure to the allergens. When it comes to medicated eye drops, the ones that effectively address itchiness, redness, and swelling are antihistamine and mast cell stabilizing eye drops. Eye drops like Pataday, Zatador, and Olaway are all dual-action eye drops. They block histamine receptors and stabilize mast cells. If you're in the United States, all 3 drops mentioned, Pataday, Zatador, and Olaway, can be bought over the counter. If you're in Canada or other countries, ask your family doctor or your optometrist to prescribe them. Just as a reminder, there are more anti-allergy eye drops than the 3 mentioned, like Bapriv, which is very effective for itchiness, Chromalin, which is a mast cell stabilizer, and even steroid-based eye drops. It's just that those eye drops all require prescription, so talk to your doctor. One study looked at the effectiveness of non-pharmacological treatments like artificial tears and cold compress and combining these treatments with anti-allergy eye drops. The authors concluded, even when the artificial tears or cold compress were used alone, there was a therapeutic effect at reducing the signs and symptoms of allergic conjunctivitis. But the best result came from combining anti-allergy eye drops with cold compress. Within 1 hour of applying 1 drop of antihistamine to each eye, followed by applying a cold compress on closed eyelid for 5 minutes, the test subjects' ocular symptoms reduced to the baseline level before they were exposed to the allergens. In my day-to-day clinical practice, one of the most common feedback I get is, "Oh, when my eyes are red, I just use some Visine." But I don't recommend using Visine or any other similar get the red out products. The majority of Visine's line of product, even the ones that are marked for allergy, have a decongestant as a part of their active ingredient. Decongestants cause vasoconstriction, so they will temporarily make your eyes look less red, but that's about it. They don't really treat the cause and just mask your symptoms temporarily. In addition, when you use Visine chronically and frequently, which you shouldn't, you may experience a rebound effect. After the effect of Visine wears off, the blood vessels in your eyes may dilate even more than before, making your eyes look even more bloodshot. These red eye drops also lose their efficacy over time, so you have to use more and more Visines to achieve the same level of effect. So you are better off doing cold compress and use medicated eye drops to begin with. There is one more thing that's important. Do not rub your eyes hard. Resist the urge to dig into your eyes. Intense eye rubbing has shown to intensify the allergic symptoms and prolong the duration of the symptoms. Intense eye rubbing can also increase your risk of developing keratoconus. Keratoconus means your cornea thins and bulges out over time. That will be for another video. Hope this video can help you out, and don't rub your eyes. I'm watching you.